Okay, thank you. Welcome to Anatomy Physiology. This is lecture number 5, and today we will talk about one of my favorite topics, the peripheral nervous system. In this peripheral nervous system, you're going to go two steps forward in your preparation. This class is going to prepare you for many things that are going to happen in your next courses. So I want please to pay attention, put your seat belts, and let's get started. Okay. So participation is important, please. The more you participate, the more you get. Okay? All right. So here we have lecture number 5, and nervous system, spinal and peripheral nerves. We are going to use some of the material that we already know from bioscience as a brief review. And after that, we are going to talk about new things. Very important. All right. Oh, what is this? What do you see there? Going back to college after 60, I changed it because actually they say 60, 50 is the new normal. My question is for all of you. Tell me, if somebody has 60, 65, 70 years old, 80 years old, 90 years old, that person can go back to college or can go to university? Do you think it's going to be successful? Yes or no?
Yes.
Excellent. Yes, it's going to.
I mean, they can go back to college. Yeah.
Yeah, they can. Yeah, many people, they want to go to college for different reasons, right? But intellectually, besides the physical status, mentally, intellectually, a person can study until whatever age they have. The answer is, as you said very well, yes. I'm going to give you some clues, some tips here. For example, you're going to you see people, elderly people doing crosswords. Why do you think that? Why do you think they're doing crosswords?
To get their brain going.
Exactly, right? So do you see some people, some elderly people, sometimes they cannot multiply things in their mind, right? But for example, can you tell me how much, probably it's the same example, I don't know, 65 times 65. And you will see that elderly people like, boom, like this. They tell you right away, right? So it's 4,225. If I ask you 85 times 85, how much is that? Nice, 7,225.
7,000. Yeah.
Lisbeth, you know, right? You know that, right? Excellent, very good.
Yeah.
All right, so if you see here, the mind is amazing. You need to train your mind, and you are able to do whatever you want with your intellectual activity level. One more thing I want to tell you, that when you're born with certain amount of nerve cells. These nerve cells are going to multiply. Yes, all the nerve cells are going to multiply. So you have one soma, an axon. They are going to multiply and give another neuron with that soma and with the axon and dendrites. So they are going to multiply, and that happened until 26 years old. The total number of all the cells in your body is 100 trillion cells, but in your nervous system is about 15% of that, so 15 trillion cells. What happened at 26 years old? So you have 20 years old, you start reproducing nerve cells more and more and more until 26. At 26, you stop reproducing nerve cells. 26, huh? And then you reach a plateau. So that means that this equal number or similar number of nerve cells during the rest of your life, not for many years. After 65, 670, you start to decay your number of nerve cells. They're going to decay lower and lower. How many they go lower? About 10,000 every day. They're going to die. But these people are very smart. They are very active and very fast on thinking. You see people with 70s and all that, right? How is that happen? How is that happen? So I will tell you now. Did I tell you this in the class before, Shafia? Did I mention this before? Yes, right? Or no?
Mentioned what?
When I'm talking right now. No?
Yeah, we've talked about it.
Okay, so I will go over again. All right, so very fast. So what happened here? What happened is that what you are doing is to multiply, doesn't matter what age you have, you're multiplying your number of dendrites. Number of dendrites. That is what you multiply. And the number of dendrites, each nerve cell, they have about 10,000 dendrites. It's like you are the nerve cell and your hair are the dendrites. Okay? So if you study, these dendrites are going to duplicate, triple, even quadruple. So they are going to increase in number. So what does it mean that? I'm going to give you an example, and I want your participation, please. When you are, let's go to San Francisco. Okay, San Francisco. San Francisco at 12, between 12 to 1. The traffic is jammed. It's a lot of traffic, right? And that is the only way you know to get into San Francisco. So you're going to take about 3 hours, 2 hours, 3 hours, 2 hours, 3 hours. Too long. But what about if you know Highway 280? Highway 280. If you know Highway 280, you're going to take the other route, and probably instead of 2-3 hours, you will be in about 1 hour, 1 hour and a half. But now, if you have already a still jam of traffic, Highway 280, what you're going to do? You're going to use another resource, that is your El Camino Real. El Camino Real is going to be another pathway. So you have 3 options in order to get to the answer. It's exactly the same what happened with the dendrites. The dendrites are going to give you the pathway. So if you don't have a direct pathway, you can have another alternative, another options in order to get to the answer. And who is going to give you that are the dendrites. And when the dendrites are going to multiply, the dendrites are going to multiply when you study. When we study, the dendrites are going to multiply. So, okay, so I have my exam tomorrow. I study tonight, and I'm going to pass because my dendrites are going to do the work. The answer is no. Why? Because the dendrites are going to take about 3 days to be formed. 3 days. 3 days to be formed. So in 3 days, so you can study today, you take the exam tomorrow, probably you will pass, but in 2 days you forgot everything. But if you have a sustainable study time, 3 times, 3 hours every day, you most likely, your long-term memory you're going to make work your temporal, the lower portion of the temporal lobe. You're going to collect the information and stay forever. When do you know that you know? When do you know a material? When do you know? You know when somebody is asking any question and you answer spontaneously without knowing where it's coming from your answer. So I don't know, I read it in the book, somebody told me, I study, I just know. That sensation is what you need to look for. That is the moment you said, yes, I'm doing the right thing. Okay? All right, so did I tell you my story very fast, Shafia, before? No?
I don't think so.
Okay, so I will tell you very fast. Look at this. I came here in 1997, so a long time ago. And I was in my country, I was a physician, I was a surgeon, OBGYN, and then I decided to go to the field, to the frontiers, the latest frontiers of my country. I enjoy it so much. I choose that for myself. And the good thing is that I was having fun, and they pay me for that, just traveling and all that, equipments and all that. Anyhow, so I was there for several years, and we was doing mobile hospitals, mobile surgical hospitals. So we was packing everything, and we was traveling in canoes and in the jungle, whatever, with Indians helping us to take all the stuff. Even 2 weeks, 10 days, 7 days walking and doing campings everywhere. Very nice. That was, I was working with the whole World Health Organization, and then they add me into the Doctor Without Borders or Frontiers. So that was my 4 years that I remember very much. Then I was having everything, money, everything you can imagine. I was very well paid and all that. I was happy. Then my father came to United States to the jungle from United States, tell me, you need to come to us because you promised you're going to come to us. I say, I don't want to go. I'm okay. So, but you promised. So, all right. So, Latin father, I need to, even at my 30 years old, I was just obeying. All right. So I came to start from ground zero. I start everything. I left everything. And I was thinking I was able to speak English. But when I came here, I didn't speak at all. I didn't know at all anything. So I was confused. I was very bad. Then when I came here, I brought my money, of course, but the money go very fast. Even when you're not working in United States, California, the money is gone very fast. And what happened? Then I start to apply for a job. So I put in my resume, the director of 3 hospitals, actually World Health Organization, etc., all the seminars, 2 pages resume, and I couldn't find a job. I went to Berkeley, I went to UCLA, I went to UCSF, nothing. Investigation, nothing, and the money was gone. I was living in the house of my parents, and then I was already running 6 months without something working, and I decided to work. So what I said is that I get rid of all. I'm a doctor, whatever, director, no more anymore. I put my name, my age, and I was saying basically I was alive. That's it. That was my resume. And when I get a job in 2 weeks. And that job was delivering newspapers. Yeah, you saw me, you're going to see me delivering newspapers. I was really delivering newspapers from 2 o'clock in the morning until 5, and then I start to work until 10. I remember that October 25th of 1997, that I received my first salary, $525. I give it everything to my father. Working every day, rain or no rain, walking 5 miles a day. 5 miles a day. I was walking, delivering newspaper. And it's funny because when I was delivering newspaper, all the animals, they knew me because there was like deers, skunks, raccoons. Nobody is scared about me. I was like a one animal like them. So I was okay. Then what happened is that I decided, well, I need to study. I need to pass my boards for a medical degree. I start to study. And when I start to study, actually, I said, oh my God, I don't remember anything at all. I don't remember anything at all. Guillermo, you know what? Be honest with yourself. You are actually, right now, you are mental retarded. And that is actually, I'm mental retarded. Oh my God, how I can be mental retarded? I cannot be. So then I start to study. And I'm working at the same time. I found a job after the newspapers. I found a job taking care of Alzheimer people. So you will see me. I was not even CNA. I was like a personal care. And I was hired because somebody was from Peru. They know me, and it was like a favor, like that. And I start to clean poo-poo, pee-pee, floors, everything, and no complaint because actually I said I was studying. I passed my boards USMLE 1 and 2, but then I decided to because at the same time I was studying in Garnick Academy. So why I didn't accept to go? Because they want to send me far away, Nebraska, I don't know what, South Dakota, and I didn't want to go. I want to stay. I love to teach. And you know what? I was forcing my brain just to study more and more. And in about 2-3 weeks, I start to make a difference. I start to feel that I can remember everything. Everything was coming back. I was retaining information. I was feeling like a sponge, fighting with the language, fighting with the material, fighting with everything, working. It was very hard time for me, very hard time. I was crying literally when I was throwing the newspapers. And crying because I say, what I'm doing here, I don't need this. I don't want to be here in the United States. I have everything in there. And and then little by little, I start to grow more and more. I passed my exams. I was happy on that. And then I found Garnick Academy in 2004. And I was studying in the basement because I was living in a basement. Paying how much for a favor? $100 only, because they knew me. Because this person, where I was living, they hired me to take care about a person who has a stroke, and he was a doctor in Harvard and psychiatric, and they took me like a son. I was lucky. They liked me. I liked them, and I was taking care of them, and I learned a lot from them: music, arts, opera, whatever, everything. I learned food, everything, manners, etc. Well, anyhow, so I in the basement I was working like right and left, pushing the information in my brain, pushing, and then I start to recover all my potential, and I was good. I feel great. I feel very good, and then I met my wife in the school. She was a student as well. She was a student. She was a student, and I was a student. So we were students. I was no teacher yet. And yeah, since then we are already since 2004 together and married happily, and that's it. So what the thing is, I want to tell you is that you can do everything you want. Everybody's coming new in this country, they need to pay the price. I pay mine. I'm very proud of that.
So you're saying that there's light at the end of the tunnel.
Exactly. And one thing that I'm very proud. I know how to throw a newspaper exactly to the door. Okay? All right. So now you have the power to do it. You are young. You actually, doesn't matter what age you are. So I came here at my 30s, and basically, you know what? At this moment, if somebody tells me you're going to come to United States, I will say no, definitely, because it was very hard. But I'm very proud that happened. Anyhow, that's it. All right. So that is about how you can basically say yourself that you can do everything you want. And that is what we are going to explain today in this class. All right, so let's get started. So you know why I'm putting this picture now, right? Perfect. Now, all right, so a small review here, very brief. We will talk about the nervous system, central nervous system in the center, peripheral nervous system going from the central outside to the extremities to the internal organ. I want just you to think about this. The central nervous system is basically where you organize all the orders, all the commands, etc. And the peripheral is basically the extensions of the nervous system who is going to let you know what is going on around you. So all the sensors that are going to feed all the information to the central nervous system are coming from your peripheral nervous system. The peripheral nervous system are a machinery that is going to detect all these changes in the environment, inside your body, in your blood, in your muscles, in your skin, pain, everything. All this information is collected and is getting into the central nervous system, where they are going to say, okay, this is happening, we need to make a decision. And that decision is going to be made and send the orders to the rest of the body. Okay? All right. So I'm going to talk about the classification of the peripheral nervous system, and we are going to do very, very easy. Oh, God. Home, new slide here. All right, so please pay attention to this because this is new. All right, so number one, I'm not going to put the peripheral the nervous system, central and peripheral. I'm going to start with the peripheral nervous system, okay? Peripheral nervous system. Peripheral nervous system. The peripheral nervous system are going to be divided into somatic, we talked about the previous class, somatic, or actually called voluntary. Voluntary. And then the peripheral are going to be the autonomic. Autonomic, or actually involuntary. Involuntary. All right. So these autonomic are going to be divided into the sympathetic, and the other one is the parasympathetic. Parasympathetic. This is review, so we are going to finish this very soon, but at the end here is going to be something new. Sympathetic, pay attention. Sympathetic is the fight or flight. Fight or flight. And the parasympathetic is going to be the rest and digest. Rest and digest. Rest and digest. The fight or flight are going to be using actually the sympathetic is going to use the adrenaline. The adrenaline. Adrenaline. And the parasympathetic is going to use the acetylcholine. 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 What is acetylcholine? What is adrenaline? Those are neurotransmitters. What are neurotransmitters? Neurotransmitters are proteins produced by the cell called neuron. So the nerve cell produces transcription, translation, proteins. Those proteins we call neurotransmitters. Why they're called neurotransmitters? Because are produced by the nerve cells. And why we call transmitters? Because transmit a message. Adrenaline. When you are upset, the adrenaline, you secrete adrenaline. That adrenaline is a message to breathe deeper because you need more oxygen, because you are fight or flight. You need oxygen for the muscles to run, to jump, to escape, to fight. Right? So your heart starts to pump faster. Adrenaline. Right? Adrenaline, sympathetic, fight or flight. You need to pump faster because you need to oxygenate, send the blood more often or faster to the lungs to receive that oxygen. Adrenaline, you are going to be more alert. You are more focused, right? So you are alert of whatever happens. So adrenaline. This adrenaline and this, please remember this, are going to look for what we call the adrenergic receptors. Adrenergic receptors. Adrenergic receptors. Adrenergic receptors. Don't forget that. Adrenaline is a neurotransmitter is considered hormone. Hormone 2 is a neurotransmitter that is going to look for a receptor. Adrenaline is the key, and the receptor is the keyhole of the door. In order to activate and to do something, you need to match the receptor with the neurotransmitter. Adrenergic receptor. Then the acetylcholine. The acetylcholine is the rest and digest. So these acetylcholine are going to look for receptors. Please, this terminology is not for this class only. Huh? You're going to find this everywhere. So that's why it's important to know what is adrenergic receptor. It's a receptor who is accepting the adrenaline, okay, to make effect. In this case, we have the parasympathetic is the rest and digest, the acetylcholine. And the acetylcholine is going to, as you can tell, are going to look for acetylcholine, cholinergic receptors, cholinergic receptors, cholinergic receptors, cholinergic receptors. Okay, so those are what we are looking at. Now, adrenergic receptors, what are these receptors? We have different type of receptors. This is new. These receptors are going to be alpha and beta. Beta receptors, alpha receptors. How many type of receptors alpha we have? We have alpha 1 and we have alpha 2. We have beta 1 and we have beta 2. Forget about the beta 3. It's like policy. We don't care about that. So alpha 1, alpha 2, beta 1, and beta 2. Those are the adrenergic receptors. In the cholinergic receptors are going to be two types of receptors. The muscarinic and the nicotinic receptor. All right, so those are the parasympathetic and the sympathetic. We will talk about the somatic later after this. All right, so what are these guys? So number one, before to get further, I want just to tell you, where is the sympathetic? You want to know where is the sympathetic nervous system in the body? Where is the parasympathetic nervous system? I will show you now. Look at that. Here we have the cerebrum, we have the cerebellum, we have the brainstem, and here we have the spinal cord. Okay, I'm going to make it better spinal cord. The spinal cord. Spinal cord. Okay, that is the spinal cord. So we have here this portion and above here, from this and above, are going to be called the cranial portion. All this is a cranial portion. I will put cranial. And here, about the sacrum, here and below here, all these below this line are going to be sacral, right? So, and here we have what we call the thoracolumbar. Thoracolumbar is going to be the, I'm going to put here, oh God, thoracolumbar area. All right, so if you see, we divide in three parts: the cranial, the sacral, and the thoracolumbar. The thoracolumbar are going to have the spinal nerves, spinal nerves. The spinal, excuse me.
Empty.
Oh, excellent. The spinal nerves that are coming from the thoracolumbar are going to be this. There's actually a ganglion here. What is a ganglion? Ganglion is the group of nerves, of body nerves. The body of the nerves is called ganglion. It's called the paravertebral ganglia. So we don't care about that. The only thing I want just to make it easy for us is to tell you the thoracolumbar, the thorax and the lumbar area of the spinal cord are going to give the sympathetic nervous system. That is the sympathetic nervous system. Sympathetic nervous system. That is sympathetic. Now, by exclusion, you can tell me now, so where is coming the parasympathetic? The parasympathetic are going to go coming from the cranial and the sacral area. So there are roots that are coming out from this cranial and the sacral area that are the extremes of the spinal cord are going to be the parasympathetic. And just remember, parasympathetic are going to work with the what? With the acetylcholine. Parasympathetic acetylcholine. And here the sympathetic are going to work with the adrenaline. All right? You okay with that?
Yes.
All right.
Yes.
So these spinal nerves, the ones who are coming out from the spinal cord, are going to go where? Everywhere. So the first thing probably you're thinking is going to be in your muscles. Yes, it's going to be in your muscles. All these spinal nerves, they can go to your muscles. They can go to the liver. to the lungs, to the heart, to the spleen, to the kidney, to the pancreas, small, large intestine, ovaries, uterus, gallbladder, arteries, veins, bile ducts, pancreatic duct, ureters, everything that you can imagine, they have an innervation. By the way, I want to be sure. Innervation, when I said innervation, means how many terminal nerves are in that organ, nerves. So the number of nerves that are going to be in that area, innervation. So all these internal organs are going to innervate by sympathetic fibers and the parasympathetic fibers. All of them. Glands, sweat glands, whatever you think, are going to be actually associated or linked with the sympathetic and the parasympathetic nervous system. So one of the things that we are going to check here are basically important, it's very important, the arteries and veins. Arteries and veins. In your program, you need to focus in arteries and veins. You're going to focus in the heart. So basically cardiovascular is your main focus when you're talking sympathetic and parasympathetic. The other one is the respiratory. So these cardiovascular and respiratory areas are everywhere, but these are actually one of the most important. Okay? All right, so just remember, where is the sympathetic and the parasympathetic? They start from the spinal cord and they distribute it all over the body. So that is the concept I want you to know. I don't want you to remember even cranial, sacral, thoracolumbar, or the paravertebral, the preganglionic, postganglionic. I don't want that because you're not going to use that. So I trim it out because you will never use it and nobody's going to ask you, no ten encles, no inges. Any question about this, please? Is clear or no?
Yes, it's clear.
Okay. So now you already have an idea where is coming from this, where they go, what is the, where they go, the sympathetic and the parasympathetic. Okay. Now, innervation. All right, so let's get started. One thing I want you to remember is this. Alpha-1 receptors, when it's stimulated by the adrenaline with adrenergic receptors, alpha-1 start to memorize that right now in the spot, okay? Use your memory right now. Use your memorization right now. Alpha-1 produce the vasoconstriction. Vaso, even the last time I'm going to say that, vaso means vessel. Constriction means narrowing. So the vessel is like this normally, and now vasoconstriction, VSC by short, is going to be like this. Now, try to blow air here. Same volume in 1 second. Now, try to blow the same volume in 1 second here. But you need to pass the same volume of air in this small one. So what you need to do is to push harder, right? To push harder in order to pass in the same time the same volume of air if you want to blow, right? So, and that is what happened. So when you need to blow harder, you need to put more pressure. So this vasoconstriction, what it's going to do is increase the force of contraction of the heart. The pump need to pump harder in order to make pass the same volume of blood in the same time, at the same time. You okay with that?
Yes.
Okay. So that is vasoconstriction. Don't forget that. Everybody, please. What is alpha-1 doing?
Vasoconstriction.
Vasoconstriction. Now, what is alpha-2 doing? Alpha-2, very, very simple. if alpha 1 produces vasoconstriction, what is doing alpha 2? Alpha 2 is
vasodilation.
Vasodilation. Vasodilation. So you already know that the vasoconstriction are going to make the heart pump harder and increase the blood pressure. Yes or no?
Yes.
Right? So now, alpha 2 is going to do the opposite. It produces vasodilation. So what happened with the heart? The heart is going to pump harder or more easier?
Easier.
More easier.
So that's why that's what it's going to do is pump with less force. So the blood pressure is going to be lower. See? Now you start to get it. So if you have low blood pressure, for whatever reason that we study later, you're going to do alpha 1. Because if you have low blood pressure, you increase the blood pressure with a vasoconstriction drug or medication, adrenaline, for example. Now, if you have high blood pressure, you want to decrease your blood pressure, and how you're doing the vasodilation. And how is the vasodilation happen? Actually doing with alpha 2 medication. Okay with that?
Yes.
Excellent. Now I will tell you now beta 1. What is doing beta 1 is going to increase the heart rate. The heart rate. I told you, please, to memorize right now. Make the effort. Know your limits. Explore your limit. No, not know your limit. Explore your limits. Increase the heart rate and increase the contractility of the heart. Contractility of the heart. Contractility. Contractility means the heart is contracting like this. Now the heart is contracting like that. Is that increase the contractility? Beta 1. You okay with that?
Yeah.
All right. So now, beta 2. Beta 2, this guy, what he's doing is produce the bronchoconstriction. I'm going to write it down, bronchoconstriction, but I'm lazy to write down bronchoconstriction all that. So I said BCD, bronchodilation. Dilation. So I put it bronchodilation. BCD. Okay, bronchodilation. So I will give you an example. Do you know somebody with asthma? Right?
Yes.
So what happened with the bronchi? Why they cannot breathe? Because they have bronchoconstriction, the opposite. The bronchi is going to get narrow. So what you're going to do? You're going to do your spray, your inhaler, your metered spray. So you have the spray, and what happened? Bronchodilation. So you start to breathe better. And what is that? That is beta 2. What is the name of that? Probably you're familiar with, is the famous albuterol. You okay with that?
Yes.
Yeah, but I'm not satisfied, and you neither. So let's make it easy now. All right, so how to remember alpha 1 and alpha 2? First of all, let me see. Just a moment. Give me my toy here. It's not toy. For this, I need to see you. Oops. Oh, I saw everybody disappear. All right, so can you see me? Okay.
Yes.
Ari, are you ready? Excellent. Very good. All right, so tell me, everybody, how many type of adrenergic receptors we have? Everybody, please. Tell me, don't be shy. Alpha 1. Say it, please. Say it with me. Alpha 1.
Alpha 1,
One,
alpha 2,
two,
Beta 1.
beta 1, beta 2.
beta 1, beta
Beta
2.
2. Alpha 1, alpha 2, beta 1, beta 2, alpha 1, alpha 2, beta 1, beta 2. So those are adrenergic receptors. So I told you that alpha 1 is the vasoconstriction, correct? All right, so now
Yes.
look at this. There is nothing here, nothing here, nothing here. Look at this. What I'm going to do. Tell me, Arby. Arby, tell me.
Constriction.
Look like what? Look like what? Arby, looks like what? What is that? What looks like what? I cannot do better. Hurry up. I'm tired. Look at what? It's not alpha, Arby. Alpha. You see that?
Is that supposed to be the letter A?
You know, alpha. Okay. What is this? What is this?
Alpha.
Alpha.
Alpha. And what is this? Beta.
Yeah.
Alpha in Greek alphabet is A. Yes, but we you know the alpha symbol, right?
No, I don't.
Okay. All right. Alpha is this. Okay. Alpha. Alpha is the same to say this. Okay? Alpha is the first letter of the Greek alphabet. That means A in our vocabulary. Alpha is like this. You okay with that?
Understood.
Yes.
Okay. Okay, that all right. So now, again, what is this? Look like what?
Alpha.
Okay, tell me alpha again. Okay, perfect. Alpha. And what is this? What is this?
1.
Now look at this. What I'm going to do, like a lace. And then
Alpha 1.
I strangulate my finger. Right? It's a lace like you're doing over your finger. That is alpha 1. That is telling you constriction. Arby, are you okay with that?
Yes.
You put your finger there, and then you strangulate your finger, and that is the vasoconstriction of alpha. Okay? You okay with that?
Yes.
All right. So alpha 2 is going to be a vasodilation, the opposite. So what is alpha 1 doing? Everybody?
Vasoconstriction.
Everybody say please.
Vasoconstriction.
And alpha 2?
Vasodilation.
Vasodilation. Okay? Okay. Arby, you want another way? I will show you another way. You have a highway. A highway, they have one lane only. Another highway, you have 2 lanes. So which is more narrow? 1 lane or 2 lanes? Which is more narrow? 1 lane or 2 lanes?
1 lane.
1 lane. That is alpha 1.
Yes.
And when you have a highway with 2 lanes, it's more wider, or no?
Correct.
Vasodilation, alpha 2. Easy or not?
Easy.
So please, everybody participate. Sherry, Sophia, Caroline, Elizabeth, Catherine.
I
Chelsea.
just said something.
Oh, you just, I don't see your mouth. I see your nose only. But anyhow. All right. So now, let's go to the beta 1. Beta 1, what is doing beta 1?
Vasodilation.
Increase of heart rate.
increase the heart rate. And increase what?
Contractility.
Contractility. Mark, tell me, how many hearts we have?
1?
Beta 1.
Oh,
You
sorry,
got
I
it?
didn't hear that. Yes.
Right? One heart, beta 1. Got it?
Got it.
Sherry, how many lungs do you have?
2.
Beta 2. 2 lungs.
Beta 2.
Okay? So beta 2 is going to be beta 2. Okay? And that is how you are going to remember, the alphas and betas. You okay with that?
Yes.
Yes.
So beta 1, one heart, increase the heart rate, increase the contractility. We have beta 2, 2 lungs produce bronchodilation. Beta 2, more wider, 2, wider, right? Bronchodilation. You okay with that?
Yes.
So that is the base of. All right. So now another way to remember. I'm going to go over this. Another way to remember is going to be this. Write it down, please. We have A, B, C, and D. A is what? Alpha, correct?
Yes.
Or no? All right. And let's make it alpha 1, and we make alpha beta 2. Alpha 1, beta 2. Another way to remember. Then you go here, alpha 1, you go to C, and B go to D. And you can tell alpha 1 produce vasoconstriction, C. Beta 2 produce bronchodilation, D. Okay?
Got it.
All right. So you have different ways in order to actually don't lose that, please. Okay? One thing, when was the last time you were upset? Let's see who I can ask.
5 minutes ago.
Today.
About 30 minutes ago.
Today.
What? Today? Why?
When I
The
took that
quiz.
quiz.
The quiz? Oh.
Yes.
All right. So
agree.
It's like
excellent.
clinicals.
Clinicals? What happened with the clinical? Is my quiz
It's
or
a
the
long,
clinical?
it's a long story.
Long story.
It's both quiz and the
Clinicals is a
clinicals.
mess.
Yeah.
Oh, okay. I will like to talk about that. Okay. All right. Because there is something that is happening. Okay. Anyhow, another one. Okay. All right. So, what I'm saying, you lost my focus. What is?
You said
The-
something was happening with clinicals.
No, I'm not talking about that. I was
Oh.
talking.
You asked when the last time we were mad was.
Oh, yeah. So, Sophia, listen to Sophia. Sophia, when you're upset, what happened with your heart?
It races.
No. Talk to me like a nurse.
I get palpitations.
What is the difference between tachycardia and palpitations? Palpitations is a symptom. Tachycardia is a sign.
Tachycardia is yeah.
Okay.
I
So
get tachycardia.
you can answer me. You increase your heart rate. Can you say it, please? Increase your heart
It
rate.
increased my heart rate.
Exactly. That's what happened when you were upset. Correct? Right?
Yes.
Your heart rate go up, and that means your heart rate beta 1 adrenaline. Adrenaline is going to activate the beta 1 to increase your heart rate. Tell me, when you get upset, you breathe more air, more oxygen, yes or no?
Yes.
Yes, right? And why
No.
is
I mean, yes. You breathe.
what no? Yes, right. So yes. Why? Because you need more oxygen to give oxygen to your muscles. Because when you're upset, you are in fight or flight. You are in defensive mode. You can attack, you can protect, you can run, you can kick. And for that, you need a lot of oxygen. So that's why the adrenaline is going to activate the beta 2 bronchodilation to give you more air. And tell me, when you're upset, your blood pressure go up or down?
Up.
Go up. So that means alpha 1. Alpha 1 are going to produce vasoconstriction, and that can lead an increase of blood pressure. You okay with that? And Mark is saying, why alpha 2? See, alpha 2 is vasodilation, and alpha 1 is vasoconstriction. Adrenaline is going to affect both at the same time. So both are going to neutralize. No. Why? Because the vessels, arteries and veins, they have many more alpha 1s than alpha 2s. Okay? So predominantly it's going to happen an increase of blood pressure. So when you want to remember all the effects of the adrenergic, are you going to remember when you get upset? You okay with that?
Yes.
Tell me, what happened with your mouth? You get wet, you are drooling when you are upset, or your mouth is dry?
It's dry.
Dry, right? So that is effect of the adrenergic receptors. Tell me, when you go to the mall and you see a nice purse that you like, Lisbeth, what happened with your eyes? Jumping out from your
My impulsive behaviors kick in.
Right. And so tell me, what happened with the pupils? The pupils are going to be dilated or small?
They dilate, yeah. They're like, oh, hell yeah, I
Dilated,
need
right?
that.
So, and who is that? Adrenaline, adrenergic receptors. See? Just remember what is the sympathetic nervous system, and that is going to when you're upset, when you are euphoric, when you are actually stimulated, when you are excited, when you are upset. So those are the sympathetic nervous system, the fight or flight. Adrenaline, adrenergic receptors, alpha 1s, alpha 2, beta 1, and beta 2. You okay with that?
Yes.
Okay. So that is one thing, and that is coming for the exam. Now we have the parasympathetic. The parasympathetic. Oh, by the way, I need to tell you one more thing for the exam before that. All right, so one thing here I want to tell you is when the pupils are dilated, are going to be called mydriasis. Question for the exam, medical terminology. Mydriasis. Pupils dilated are going to be mydriasis. Mydriasis. Don't forget that. Okay? Mydriasis. Mydriasis. Okay? All right. Perfect. Now, let's start with the parasympathetic. The parasympathetic is going to be the rest and digest. Rest and digest. So, but think about you're resting, parasympathetic. You're digesting, eating, that is parasympathetic. And that is going to use the acetylcholine. They're looking for the cholinergic receptors. Which are these cholinergic receptors? The muscarinic and the nicotinic. You want NCLEX question? I'm going to give you an NCLEX question. The effect that we are looking in medicine for a treatment with cholinergic is the muscarinic, not the nicotinic, the muscarinic. A must. You must think about the muscarinic. So that is the effect we are looking for. Now, the cholinergic are going to be one mnemonic here. The cholinergic receptors that are using the acetylcholine are going to be, remember, write down this, everything what? Everything wet. Everything is wet with acetylcholine. Everything is wet with acetylcholine. Everything is wet with acetylcholine. When you have acetylcholine, you remember the giant cat. You remember the giant cat? Yeah. The giant cat. Remember the giant cat, Steffi?
Yes.
Right? So what is doing the acetylcholine there? The contraction, correct? Excellent. All right. So now, why everything wet? Because they are going to contract the urinary bladder. P. That is wet. That is wet. when you go to poo. When you go to poo, what happened? The contraction of the rectum that is going to make you defecate. That is wet again. So acetylcholine make you pee. Acetylcholine make you poo. And tell me one thing, rest and digest. You didn't eat 2 days. And I show you in front of you a New York steak, Angus or grass-fed. You're going to start drooling, no? Or no?
Yeah.
Right? So what it's doing is making you produce more saliva. That is wet again. Wet again. So when you are talking about acetylcholine, everything wet. They make you pee, they make you poo and drool. Drooling. Drooling, pee, poo. Drooling, pee, poo. Drooling, pee, poo. Drooling, pee, poo. That is everything wet. Acetylcholine. Acetylcholine. Is that clear?
Yes.
Yes.
I'm going to ask that. In next class, I'm going to ask. And actually, I want better grades. Okay, so all right. So we okay with that? Now let's complete that, Miss Arby. Probably you heard of this before, and we are going to make have some homework here. Chelsea and James probably they are going to help us with that. Okay, all right. So now, you know the sympathetic for one side is going to be activated when the look at my hands when the sympathetic go up, stimulated, producing a lot of adrenaline. The parasympathetic go down. When the parasympathetic go up, the sympathetic go down. So never is like a teeter-totter. I don't know how you pronounce that, but up and down. But never is going to be both up, never go both down. It's going to be one high and the other low. When this low and then become high, the other become low. You okay with that?
Yes.
Now, the homework for, I make this homework before, so I'm going to give it to James and Chelsea. You can go together if you want, okay? All right. So what I want you to do, guys, is to prove that the acetylcholine and the adrenaline are going to do opposite. How we are going to do that? I want you to, after class, put your tennis shoes, and you are going to run around the house. Run as fast as you can. Run. And when you are running, try to poo and pee at the same time. Can you do that?
Liz, your mic.
Right? Can you pee and poo at the same time in time you're running? Try to run and pee. All right? So that is what it's telling you. When you are running RV, your sympathetic is high. So that's why your parasympathetic is low. We got it? All right? Is that clear? Okay,
Clear.
so that is the parasympathetic and the sympathetic. All right, so let's complete that with the somatic. All right, the somatic. By the way, so all right, so tell me one thing. If you have adrenaline, produce bronchodilation, correct? Yes or no? What happened with acetylcholine? Is the adrenaline produce bronchodilation? What happened with acetylcholine?
The opposite.
Shafia, excellent. The opposite. Everybody got that? The opposite. Look at this. This is crucial. Huh? Now, tell me, if when you are upset, you are sympathetic, your mouth is dry or wet? Dry, right? So what happened with acetylcholine?
It's wet.
The opposite. Tell me, Now, if you are upset, adrenaline, sympathetic, your heart rate is going up, right? Yes or no?
Yeah.
What's happened with acetylcholine?
Going
The
down.
opposite. It goes
Go
down.
down. Yes, produce bradycardia. There you are. So if you want to remember the acetylcholine effect, you need to remember when you get upset. When you get upset, all the opposite is going to be the parasympathetic. Tell me one thing. If your pupils, you see something that you like very much, your pupils are dilated, could produce mydriasis. So if you have sympathetic, you are alert, your pupils are bigger. Why? Because you want more light in order to escape, to find a solution or whatever, right? So what happened with acetylcholine? The pupils are going to be dilated or constricted.
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 So that is a way to remember. And this constriction is going to be called meiosis. So you already know the word mydriasis, and the pupils who are constricted are going to be called meiosis. Meiosis. Okay? Meiosis is the pupils are very tiny. Mydriasis, the pupils are very, very dilated. Open. Is that clear?
Yes.
Okay. So that is the game. That is the game. In the future, they're going to ask you, what is the action of the acetylcholine? What is the cholinergic effect? Cholinergic effect. Cholinergic effect is based on the activation of the cholinergic receptors. So if I tell you, I give you a cholinergic agent, that means I'm giving you acetylcholine. So all the signs and symptoms that I just mentioned. And that is important because that is what they like to ask in KC and NCLEX. Now, if I tell you a cholinergic agent, how about if I tell you an anticholinergic agent? An anticholinergic agent, like the atropine, are going to be the opposite of the acetylcholine. In other words, the anticholinergic are going to be same as the adrenergic receptors. Everybody got that?
Yes.
Everybody got that? If not, okay, the next quiz is going to tell. All right, so I'm trying to be clear and repeat it as many times you need it. So please, okay? All right, so that is about. All right, what else I need to say here? Oh, the somatic. The somatic, let me see, I cannot delete that. Let me see. Okay. All right. The somatic that we left at the end, the somatic is going to be a voluntary, as we already talked. And the somatic, what is the neurotransmitter that is going to use? Everybody? What is the neurotransmitter that is going to use the somatic?
Acetylcholine.
Acetylcholine. Excellent. Somatic, voluntary, striate muscle, giant cat. Try to correlate things. Try to link things. That is a way to remember. Right? So don't try to divorce concepts. Try to unify the concepts. That is going to give you all the I will say material that you can elaborate and process the information and give answers. So the somatic is the acetylcholine. So we have the peripheral nervous system, we have somatic, and parasympathetic are going to be cholinergic. And the only one who is the adrenaline is the sympathetic. You okay with that?
Yes.
All right. So now, one more thing I want to go here is this. Look, this is a question for exam. Okay. We have adrenaline. Write it down. Adrenaline is the same to say epinephrine. Noradrenaline is called a norepinephrine. It's the same. Now, all together are going to be called, question for exam, 10 points, catecholamines. Catecholamines. Those are the catecholamines. So listen to this. Don't get confused. Adrenaline, what is adrenaline? A catecholamine. What is noradrenaline? A catecholamine. What is epinephrine? A catecholamine. What is norepinephrine? Catecholamine. Give me one catecholamine. Catecholamine, norepinephrine. Another catecholamine, adrenaline. Another catecholamine, noradrenaline. Another catecholamine, epinephrine. What is adrenaline, epinephrine, noradrenaline, and norepinephrine? Catecholamines. So whatever you want to say, all of them are going to be individual or in group catecholamines. We okay with that?
Yes.
And these catecholamines are going to have actually an adrenergic, looking for adrenergic receptors. Alphas, beta 1, beta 2, alpha 1, and alpha 2. Okay. All right. So, Mark, we have a break or no?
I'm down for it.
You're done? You don't want it?
No, I mean, yes.
Oh, okay.
Yes. I'd love a break.
All right. So let's make a lunch break. That's okay? Until, it's okay? 7. I'm going to be 7:30. What about that?
Sounds good. Thank you.
Besides that, any question?
Mediterranean veggie sandwich. Baked beef dish supreme pizza.
I said lunch, everybody will fly. Okay, everybody's hungry, I guess. Okay. See you.
Smoked trailer pulled pork.
Hello? Hello, hello.
Hello.
Excellent, very good. All right. All right, so autonomic nervous system are going to control a smooth muscle of the internal glands, internal organs and glands. So basically, as I mentioned, the autonomic nervous system are going to be everywhere. So from your internal organs, including the vessels, the spleen, all the organs are going to be conformed by the autonomic nervous system, sympathetic and the parasympathetic. So organs can respond to sympathetic effect or to cholinergic effect. Okay, so that is the summary of the autonomic and nervous system. You okay with that?
Yes.
All right. So now here we are going to see this is a nerve. You see here all the dendrites. Remember, the dendrites, when you study, are going to start forming in about 3 days. 3 days is where you're going to start collecting information and stay for a long period of time. All right, so the type of nerve cells that we have the sensory and the motor neurons. The sensory nerve are going to show you this image that you're already familiar with, is that, and that is a review from previous course. We have here a muscle. This is a muscle. This is the muscle. And this is the receptor. Receptor are going to be those receptors who are under the skin, for example, or receptors who are in the internal organs. We have, remember, the Krauser, the Meissner, the Pacini, all these receptors who are basically in the subcutaneous tissue, in the dermis, in the skin, and immersed in different organs of the body. All right, so let's suppose that you have, this is your hand, 1, 2, 3, 4, 5 fingers, and actually you're going to touch a hot teapot. All right, so what happened? So these receptors on the hand are going to send the stimulation here all the way to this spinal nerve, and they go to this cross-sectional, showing here cross-sectional of the spinal cord. They are going to go to the posterior portion of the spinal cord. How I know it's posterior? Very simple. Look at this. If you see here a cross-section of the medulla or the spinal cord, you will see that this is exactly the same shape that all the graphics are going to show. If you put here a line here, that is showing like an A. So this is anterior. All right, so always just to guide yourself. And here we have the posterior, look like a butt, correct? So this is posterior. So posterior and anterior. All right, so what happened with the hot tea? You touch the hot teapot, and the stimulus are going to go all the way. Can you see the direction of the stimulus here? Are going to go to the spinal cord. In the spinal cord, what they are doing is they are going to travel the information all the way up to the neocortex or cortex of the brain. It's going to go to the parietal lobe, that is, or you already know, is the somatosensory area. All the sensations are going to be there. Are going to interconnect with the motor area, that is the frontal lobe, and they are going to send a back information here. At the same level of the cross-section, they are going to go directly here to this other portion, this other spinal nerve. This spinal nerve, the electrical impulse are going to go in this direction, towards the muscle. And that is what is take your hand out of the hot teapot. So if you see here, the circuit is going to be this neuron going to the spinal cord, go up to the cortex, waiting for the response and response of the process of the stimulus, and they go to this other nerve, and that is going to produce actually remove your hand from the area of causing the pain. This nerve is called the afferent the afferent spinal nerve, and this is called the efferent spinal nerve. Who is first, afferent or efferent? Afferent. Why? How you can remember that? A is first and E is second. A and E. Who is first? The afferent. The afferent is bringing the signal to the central nervous system up to the cortex. Then they go down, and they are going to send the response through the efferent. So the muscles of your hand are going to be you're going to remove your hand from the teapot, and that is how it's going to happen. Okay, so when you are having the pain here, the pain is traveling, stimulus is traveling to the spinal cord. You at this moment, you don't feel the pain yet. The pain is going to be feeling, or you are going to be aware of the pain when these stimulus go to the cortex, especially to the parietal lobe. That is when you're going to say, ouch. Okay, just when they arrive into the parietal lobe. They go back, they go to the efferent to send the order to remove your hand from the hot teapot. Be okay? Afferent and efferent. Be okay with that?
Yes.
Yes.
Okay. So now, here we have the arc reflex. We are going to talk about the arc reflex. The arc reflex are going to be arc reflex. That is part of your nursing assessment when you are doing the physical exam of the nervous system. One of the last portions of the assessment is going to be the arc reflex. Arc reflex we have, for example, in the knee, on the knee, below the kneecap, you hit the kneecap, or below the kneecap, there is a tendon there, right? These tendons are going to basically make your kick your foot, right? Almost automatically. You don't even you feel the sensation and the movement almost simultaneously. Why is that? Because this is the arc reflex. You hit here your knee here. That's the knee. With a small tool or with a small hammer, we special for that. You're going to hit, and the stimulus is going to go to the afferent again. From the afferent, they reach the spinal cord. From the spinal cord, instead to go up to the neocortex or cortex, they're going to bypass, and they are going to go directly to the efferent. You see this arch or this arc, whatever you want, that is the arc reflex. They go to the efferent, and your foot, your leg is going to kick, correct? So who is doing this bridge? The bridge between the afferent and the efferent is going to be by another neuron that is called the interneuron. Interneuron means inter, in between, right? In between neurons. Which one? Afferent, in between the afferent and the efferent. So that's how it's going to be acting the arc reflex. Okay? So that is called the DTR. Write down that. The DTR is a deep tendon reflex. Deep tendon reflex. Deep tendon reflex. Okay? When you are going to do the assessment or the physical exam in neuro, you need to, if you want, I can show you, I can teach you what are the steps on that. This is not the moment. All right, so we okay with that?
Yes.
All right. So now, that was part of bioscience. Let's go a little bit more deeper now. All right, so here we are going to see here that we have the response of so the afferent is not here, only the efferent. So here we have from the brain, the cortex, they're going to pass all the lobes. They're going to pass the cerebellum, the brainstem, and they go directly to the spinal cord. So this is what we call the motor neuron. The motor neuron. Motor neuron. Motor neuron. Please pay attention to this. So everything that is stay on the central nervous system is going to be the motor neuron. Sometimes we call the first neuron. All right? motor neuron, sorry. The first motor neuron. And the other name is because it's higher, is called upper motor neuron. Upper motor neuron. You can call upper motor neuron. We have first motor neuron or motor neuron is the same. Now, from everything stays still in the central nervous system. But when they go this efferent, going to go to the muscle, like through the spinal nerves, outside of the central nervous system, that is called the lower motor neuron, the lower or the second motor neuron. So let's stick with one name, the upper motor neuron and the lower motor neuron. Okay? All right. So that is important. Why? Because I'm going to teach you something in addition. We are going to see that any damage on this upper motor neuron or any damage on the lower motor neuron, you can tell. So it's going to be important to determine where is the lesion of the patient, in the patient. In both cases, the upper and the lower motor neuron are going to produce paralysis. Paralysis, okay? Now, when you have a paralysis, you cannot move your arms or your lower extremity, whatever. You cannot move, all right? Partially could be paraplegia, hemiplegia, quadriplegia, whatever are going to be. For extremities, quadriplegia. Paraplegia is going to be lower extremities or upper extremities. Hemiplegia could be the right side or the left side paralysis. Now, when this paralysis, probably you saw somebody with paralysis in the hospital, the paralysis are going to be two types. The spastic paralysis, and the other one is the flaccid paralysis. Flaccid paralysis is when you totally relax. So you move easily. So you cannot, the patient cannot move, it's paralytic. But when you try to move the extremities, there is no stiffness. It's going to be just, I would say, you can move it, right, without any effort. Spastic, yes, is going to have a rigidity. Okay, this is flexible, and the spastic is rigidity. So it's going to be totally stiff and permanent. So you cannot really do any movement because the muscles are completely contracted. All right, the spastic rigidity, the spastic paralysis are going to be characteristic of the upper motor neuron. When you have any lesion from the cortex to the medulla, any portion of this, they are going to produce a spastic paralysis, rigidity. So you cannot actually very stiff. And if you have a lesion on the lower motor neuron, that is a spinal nerve or spinal nerve are coming from outside of the central medulla to the peripheral organs, like in this case, the muscle, that is going to cause a flaccid paralysis. You okay with that?
Yes.
All right. So I'm giving you a little bit high level, so please pay attention. Now, there is a test that are going to be in your exercises. The test is called to recognize if this is upper motor neuron paralysis or lower motor neuron paralysis. There is a sign. That is a test called the Babinski sign. This Babinski sign, I'm going to try to find a video. I think I forgot to upload here in the PowerPoint, but I'm going to find it very fast. Hopefully, yes, this is the one. All right, are you ready?
This is the world's first reusable cotton swab.
No, that is not. That is
It
not.
removes up to 5 times more excessive wax.
In this video, I'm going to demonstrate the Babinski sign, which is used in neurological screening. Hi and welcome back to Physio Tutors. The Babinski sign has a reported sensitivity of 51% and specificity of 99% in the detection of an upper motor neuron lesion, as reported in a study by Jaramillo et al. In year 2014. To test for the Babinski sign, run a pointed object from the heel along the lateral aspect of the foot forwards towards the great toe. In a normal human being, it will result in the flexor reflex or grasping of the toes. The Babinski sign or reflex is a pathological reflex and is characterized by extension of the big toe and abduction of the other toes, which is also called the fan sign or signe de levante. In severe cases, the Babinski sign may be accompanied by hip and knee flexion.
Okay, we got it. So here, sorry for that. I'm going to cut this. Sorry, I shouldn't do it. Okay. Great view. Okay. All right. So there you are. So this is the Babinski. This is your foot, and you're going to do this. You're going to, on the side, you're going to have a metal. And this is the hammer, the tip of the hammer. That is a metal that is going to be easy to slide, and you're going to press like this and go to the big toe like this, something like that. Right? So it's not like this. It's not like all the way up. It's going to be in the middle. You go down towards the big toe. And what happened? Normally, what you're doing is this. So you put your toes like this. But it's abnormal when your fingers are doing this. Open, the opposite, like a fan. So that is a positive Babinski. So that means that your upper motor neuron is the one who is affected. You confirm that because the paralysis of the patient is spastic. Spastic means rigidity. Is that clear or no? You okay with that? All right, so
yes.
You have 2 steps in front with this. Okay, so let's keep going. Okay, I should put this in the break. Come on, and there you are. I want you to observe. I want you to observe the waves of the ocean. Relax. Think about something beautiful. Because the next thing we are going to talk are going to be about the neurotransmitters. And that is a good example how the neurotransmitters are going to be transported. Waves after waves. If I have some object floating in this area, whatever, the next day you come back and you will see that object is going to be located on the beach. Yes or no?
Yes.
Yes. Okay, perfect. So let's keep moving. All right, so here we have, keep in mind that we are going to go back in a few moments. So here we have the connection between the nerve cells. So the nerve cells, you have a nerve, like for example, the sciatic nerve, we have, that is in the lower extremity. We have the radial nerve that is on the upper extremity. We have the median, we have the ulnar nerve. So those nerves are going to be same names as the arteries, same name, but are nerves, okay? All right. A nerve is a group of millions and millions of nerve cells. So is this one nerve cell? They're going to be like a rope of millions of connections of nerve cells. And that is going to create a nerve. The largest nerve in the body is going to be the sciatic nerve. Where is located? In the lower extremity. All right. So saying that, I want just to go focus on this now. So this is the nerve cells, and the nerve cells, you know, the soma, the body, the dendrites, the axon, covered here with the Schwann cells, the oligodendrocytes, another name, and here we have this like a sausage, are the myelin. All right. So now look at this, the distribution or the location of the nerves. The nerves are going to be one nerve cell are going to be up to here, and then it's connecting to the next nerve cell, and then to the next nerve cell. So what does it mean? That we have, remember this? Remember this or not? Sodium, calcium, potassium, chloro, magnesium. Remember that? Remember?
Yes.
Yes.
Okay. Excellent. So we are going to talk about the action potential. Action potential. Don't be afraid of this name. What is action potential? Action potential is how you produce electrical impulse. Electrical impulse. The electrical impulse. Electrical impulse. So that means that is not continuous. Is as a pulse. Boom, 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 boom. Electrical impulse, action potential. All right, so the action potential are going to start on the body of the nerve cell, and then the electrical impulse are going to travel through the axon, in what we call jumping, like a leaps, like a saltatory. In this case, is actually why, because we have the Schwann cells that are going to accelerate the electrical impulse pathway away. So they are going to go this way, and they go to the axon, then go to the terminal axon. This is the terminal axon, and from the terminal axon, they are going to connect to the next dendrite. So that is how they communicate the nerve cells. It's going to go in this direction, not in the opposite. They don't go to the axon and the body, and they go from the terminal axon to the dendrite. Is that clear?
Yes.
Yes.
Okay, now that is the first part. The second part of this is just to show you here. This is a normal cell with a nucleus, and basically let's do this. Let's pull this, let's push here, pull here, let's make a shape. And this shape is going to end as a nerve cell. Yes, all this is a nerve cell. This is the cytoplasmatic membrane. All these projections are cytoplasmatic membrane. All these projections of the axon are cytoplasmatic membrane. And it's going to be like a channel. What is inside the channel? Cytoplasm. And they are going to go to this is a cell membrane, and inside we have cytoplasm. So it's a cell, practically it's a cell. That's so the only thing is different shape. Now, as a cell, you already know that the cells are they have the DNA, the RNA, produce that transcription and that translation. And these produce proteins. So the nerve cells are going to produce proteins. Nerve cells produce proteins. These proteins are located here. All right, perfect. So these proteins are going to be called the neurotransmitters. So neurotransmitters, what are those? Are proteins. Proteins produced by whom? By the cell, transcription, translation. Now, these neurotransmitters, for example, we have the adrenaline. For example, we have the noradrenaline. For example, we have the serotonin. Serotonin is the mood for mood disorder. So you have low serotonin, you are very depressed, depression. Acetylcholine. All are these neurotransmitters. Why? Because they are proteins produced by the nerve cell. Now, these proteins, these neurotransmitters are going to transmit a message, and they are going to travel through the axon. They're going to travel through the axon. They reach the terminal axon, and they are going to basically go into this area in between the dendrite, and they are going to pass to the dendrite. So terminal axon, go to the dendrite. From the terminal axon, they go to the dendrites of the next nerve cell. From the terminal axon here, they pass to the next dendrite. How is that happening? That is happening because they go hand by hand with the electrical impulse, the action potential. The electrical impulse is going to be like the waves of the ocean that you see in the previous. And that each wave, each pulse is going to push forward like a ball on the ocean, push forward. Each wave are going to push forward the ball towards the beach. So that is exactly the same what happened here. The electrical impulse are going to push bit by bit the neurotransmitter. Another electrical impulse, the neurotransmitter is here. Another electrical impulse, neurotransmitters are here. Another electrical impulse, the neurotransmitter is here. Another electrical impulse, the neurotransmitters are here. Another electrical impulse are going to release and pass the neurotransmitter to the next dendrite. Be okay with that?
Yes.
All right. So now you know how the electrical impulse is vital for survival. So we have adrenaline, noradrenaline, serotonin, acetylcholine. We have GABA, we have dopamine, we have glutamate, we have many others neurotransmitters that are going to have an effect. Okay? All right. So now, let's go focus now in more detail on what we call the synapses. The synapses. What is the synapses? The synapses is we are going to make this area. Look at this. From this area and that. So that is the synapses. The synapses is going to comprise the terminal axon, the dendrite of the next nerve cell, and the space. Always there is a space. Always. It's called the synaptic gap. And let's see what we have in the next slide. All right, so these are the electrical impulses. Okay. Hold on.
A child's experiences during the earliest years of life. Through this process, neurons form strong circuits and connections for emotions, motor skills, behavioral control, logic, language, and memory during the early critical period of development. With repeated use, these circuits become more efficient and connect to other areas of the brain more rapidly. While they originate in specific areas of the brain, the circuits are interconnected. You can't have one type of skill without the others to support it. Like building a house, everything.
So you see here, all these, this cartoon is going to show you how the electrical impulse are going to work in the brain. So sharing information from one side to another. For this, I need to talk about the neurotransmitters. Talking about the neurotransmitters, I want, just because I don't want to do less than in the morning, I'm going to show you now. Please, this is important. All right. So please, in the future, there's a lot of confusion and make basically the student refuse to learn things. So, but there's a very simple thing that you need to be aware. So we have the neurotransmitters. The neurotransmitters are going to have dual action. Dual action. What is that dual action? The dual action will be the neurotransmitters acting at the level of the central nervous system. The neurotransmitters are going to have a different activity in the peripheral nervous system. In the central nervous system, for example, we have the adrenaline. Adrenaline is going to make you be alert, right? It's going to make you breathe faster. All the sympathetic, central nervous system in the brain, is going to increase your concentration. So, example, tell me, there are some people who work better under stress, yes or no? The stress is going to make you increase the adrenaline. When you are calm and actually in peace, you try to find a solution or something, and you cannot find it. But when you are in the stress, your adrenaline is going to give you an increase in your cognitive functions. And that is the moment you can find a solution. Yes or no? That happened to you? That happened to me too, right? Adrenaline. And the PNS, the peripheral nervous system, adrenaline produces the vasoconstriction, the vasodilation, increase of the heart rate, increased contractility, increased bronchodilation. Let's talk about another one, the acetylcholine. The acetylcholine is going to be a mood control, and they're participating in the mood, and they're going to produce the focusing. So you need acetylcholine for focusing. Acetylcholine for focusing in the central nervous system. But in the peripheral nervous system, the acetylcholine are going to behave like it's going to be different. Remember the giant cat, for example, right? It's going to make muscle contraction. Yes or no?
Yes.
Another one, thank you, are going to be the serotonin. Serotonin is going to be the mood neurotransmitter. You have normal levels of serotonin, you feel okay, you feel calm, you feel in peace, you don't feel unhappy, you feel okay, totally neutral, right? But if you have low levels of serotonin, these are going to give you depression. Low levels of serotonin, they are going to give you depression. So that these patients low in serotonin are going to have depression. That is in the central nervous system. But what happened in the peripheral nervous system? In the peripheral nervous system, you cannot imagine. It's going to participate in the peristalsis of the GI tract. How different, right? So different action, dual action. Another one, the dopamine. Dopamine is going to produce by the central nervous system, and the central nervous system is giving you the reward. So you have a pleasure. That is a reward, giving you a reward, and that increases the dopamine. Smokers, for example, they have high dopamine. Why? Because when you smoke, the smoking is going to increase the dopamine. So that's why it's having some addictive activity on the person. So that's why it's difficult to leave the cigarette, because the dopamine is always high. It's a reward hormone. And actually, in the peripheral nervous system, what it's going to do is to control the fine movements of your hand, movement of your body, movement. So, for example, I'm going to take my Coca-Cola here. I have good dopamine. Salud. Okay, Coca-Cola. Okay, nice. Now, I have good dopamine. Now, I don't have dopamine. Very low dopamine. See? That is what is caused the low dopamine. And these tremors are characteristics of what? Of Parkinson. Parkinson disease. These are tremors that is permanently happening in the patient. So that is because low levels of dopamine. Right now, what I want you to tell you is this. These neurotransmitters, they have dual activity. Dopamine in the peripheral nervous system, in addition, can produce vasoconstriction by receptors DOPA. That I'm not going to talk about that now. Okay? We got it?
Yeah.
Okay. Now, look at this. I'm going to make example of two things. Depression and schizophrenia. Those are directly related to the neurotransmitters. Depression means down. So all these neurotransmitters, especially the serotonin, are going to be low. And schizophrenia, schizo means division, phrenia means personality. So you have at least two personalities, schizophrenia. And what happened with the schizophrenia? With the schizophrenia, all the neurotransmitters chaotically are going to be high. You okay with that? All right. So now, we need to understand how the body is trying to control that through the synapses that we are going to explain in a few moments. All right, so let's get started. All right, so this is just to let you know how is the electrical impulse
is an electrical
coming.
current that travels along dendrites or axons due to ions moving through voltage-gated channels in the neuron's plasma membrane. Voltage-gated channels open and close in response to an electrical voltage. So
that is the way they're going to. So what is going to happen? Sodium, calcium, potassium out, chloro out, magnesium out. Okay? All right, so the action potential, I start here. The entry of sodium and calcium. Okay? All right, so let's keep moving. All right, so this is the synapses. I'm talking about this synapses. Let's see what we have here. What is this? This is the axon. And what is inside the neurotransmitters? Terminal axon here. This is the terminal axon. This is the terminal axon here. And the below here is the dendrite. So the terminal axon are going to receive an electrical impulse, and all these neurotransmitters are going to pass. So this area is called because all these synapses, this is presynaptic area. All this is the presynaptic or presynapses. This area here that I'm showing you here is the postsynaptic. And the space that is everywhere is happening exactly the same. This is the synaptic gap. So this is pre, this is post, this is synaptic gap. Pre, gap, post. Pre, gap, post. Presynaptic, synaptic gap, and the postsynaptic. So these neurotransmitters are going to pass from the presynaptic, and they are going to go to the synaptic gap and look for the receptors in the postsynaptic. Okay? You follow me? Yes?
Yes, sir.
Excellent.
Laura, get your iPhone, buddy. I got my iPhone. Yeah, that boy, Justice. Crocodile. Where? Yeah. Where? Where they are coming out, jumping on the rock. There. Right? The crocodile down. Oh, slow. Where's below them? No, where's the crocodile? No. Justice, you gotta tell us this. Is it floating? I see it floating. Where, Laura? Downstream here. Oh, there he is. Yes, come on.
There you are.
Watch that crocodile. Who's on crocodile watch?
All right, so I show you this picture. Why? Because a reason. The reason to show you this is because I want you to understand one thing here. This is a Serengeti River. Serengeti River is in Nigeria, I guess, is the country that every season the buffaloes are going to pass a river. This river are going to be in the pathway of these buffaloes. And what happened here is that in the river there's crocodiles that are going to eat the buffaloes. Why I'm saying that? Let's start. Listen carefully. Here we have the presynaptic. Here we have the synaptic gap. So this is the presynaptic. And this is, I'm going to exaggerate a little bit the distance between them. This is actually the terminal axon, right? Terminal axon, the presynaptic. and the postsynaptic here. Postsynaptic here. That is the dendrite of the next nerve cell. All right. So now this area is the synaptic gap. All this area is the synaptic gap. All these three are going to be called synapses. All right, we okay with that? Now, here we have the remember the Serengeti River. Here we have the neurotransmitters. These neurotransmitters are going to be the buffaloes that you see there, and they're going to pass to the next side of the river. The synaptic gap is the river. Now, this is one side of the river, the other shore of the river here. They want to pass from here to here, from the pre to the postsynaptic, but they need to have the synaptic gap. Now, here we have an auto control. So I will tell you. For example, let's make it serotonin. Serotonin is the mood neurotransmitter, right? So serotonin then is going to be released. It's going to be released. And what happened? Number one is going to pass directly. Pass directly. Pass directly. That is one option. Passing directly without any problem. The other is that we have here a crocodile. Let's make a crocodile like this. I don't know how to draw a crocodile. A crocodile. This crocodile is an enzyme that we have in every synapses. All the synapses, they have this enzyme. All these, whatever, adrenaline or adrenaline glutamate, whatever I mentioned, all of them are the same. They have an enzyme. Enzyme, different name, but an enzyme. And what is doing this enzyme? To destroy the neurotransmitters who are passing in the synaptic gap. Why is doing that? Why do we have that? Why? Because you don't want to have an excess of neurotransmitter. So that is an auto-regulatory process where the body is going to have always the amount of neurotransmitters that is needed. So some of them are going to be destroyed by this enzyme, by this crocodile. That's what is happening in the Serengeti River. So that is the second option. So destruction. Destroy neurotransmitter. Passing directly. So that is number two. Destroy. To control, to have the right amount of neurotransmitter to pass to the next nerve cell. And the third option, and the last, is that here we have the neurotransmitter, and the crocodile is here. Crocodile is here. Let's make a crocodile, I don't know, crocodile with eye here. And these are going to tell, oh, you are a crocodile. You want to eat me, right? You want to eat me. So what I'm going to do is to come back, to return. That is called the reuptake. So there's three options here. Three options. The one option is the neurotransmitter, dopamine or adrenaline, or whatever you want, are going to pass directly. Second is going to be the destruction of the crocodile, the enzyme that is being destroyed, these neurotransmitters. And the other option is the reuptake. So they are not going to pass, they're going to come back to the presynaptic. Okay? Now, what happened with the serotonin when you are depressed? When you are depressed, you have low levels of serotonin. There is too much destruction of the neurotransmitters, or too many are going to return to the presynaptic. What we want is more serotonin. And how one of the treatments is going to be what we call the Ssri. It's just an example. I'm not going to actually ask about this, but I want to illustrate. What is the Ssri? Look at this. Ssri is the selective serotonin reuptake. So this is the reuptake, the coming back. Inhibitor. That is the Ssri. And this reuptake inhibitor, what it's going to do is to inhibit the return. So as a consequence, there are going to be more serotonin passing to the postsynaptic. Is that clear or no? Hello? Are you there?
Yes,
Yep, it's clear.
It's clear? Okay. All right. So, and just remember the dopamine. The dopamine, what is doing, what we want to do in the Parkinson, the treatment for Parkinson is going to be that they are going to give more dopamine, PO, by mouth, and they are going to be basically going to the nerve cells and passing in more quantity. Doesn't matter if there is a lot of crocodiles, because you're giving a lot of dopamine. This dopamine is going to compensate the destruction of the dopamine. So you have more dopamine. That is the treatment for Parkinson. And knowing these mechanisms, you know all the pathophysiology of many diseases. One of them is Parkinson. Okay? One of them is schizophrenia. So what is a schizophrenia? Schizophrenia means that you have too many of these production. So what they are going to is basically activate these crocodiles to destroy more, to decrease the storm of chaotic production of neurotransmitters. Schizophrenia, too high neurotransmitter. Depression, you do the opposite. You want to increase the neurotransmitter, because in depression, all the neurotransmitters are low. You okay with that?
Yes.
So where is the presynaptic? Here. What is the river? The synaptic gap. Who are the buffaloes? The neurotransmitters. This shore is the postsynaptic. And then you're going to see here our friend, the crocodile.
He's gonna get one.
Don't worry, it's not going to eat anybody. I saw already.
Oh no! This is sad.
You got it.
He was lucky. Got it? All right. We finished with saving one buffalo. All right.
Neurons communicate with each other, relaying messages throughout your body and powering all of your thoughts and actions. Neurons talk to each other using both electrical and chemical signals. Messages start as electrical signals traveling rapidly down a neuron. These signals are called action potentials. When they reach the gap between two neurons, the messages need some help to get across. The information is transformed from an action potential into a chemical message, which crosses the gap called a synapse. The release of those chemical messengers can trigger an action potential in the neuron on the other side of the synapse, conveying the message onward. Or it can quiet the message. This happens over and over and over. And with repeated activity, the synapse gets stronger. So the
Okay, you got it, that? All right, so when you're going to do, because I don't want to delete something there, but we are not going to use the preganglionic. That is different from synapses. Postganglionic we are not going to use. So you just actually pass this slide, okay? All right, so we was talking about the sympathetic nervous system. If you see here, that is the thoracolumbar. So all these are the beginning of the sympathetic nervous system, what is in green. What is in red here and here, those are the cranial, and this is the sacral. That is the parasympathetic. And remember, all organs, they have sympathetic, all organs have parasympathetic. So all these nerves are going to travel and get into the organ, because each organ has a sympathetic, another have a parasympathetic response. You okay with that?
Yes.
Okay, so here we have the neurotransmitters, as you see here in this cartoon. Example, we have, what I want you to remember is the dopamine. This is question for the exam. Dopamine. Just to let you know where is the dopamine, if you are more curious on that, I will tell you this. This is the brain, a coronal cut of the brain. We already know that this is the diencephalon, with the hypothalamus and the thalamus. All this is the diencephalon. Side by side in the temporal lobe are going to be the limbic system. This is the limbic system, limbic system, limbic system, limbic system, limbic system. And in between the limbic and the diencephalon, we have the basal ganglia. That is the basal ganglia. The basal ganglia are the one who produce the dopamine. Dopamine. When the dopamine is going down, for example, you have multiple, often head traumas. Head traumas. Head traumas, for example, sport, boxing. So boxing, you hit your head every time, right? So that shakiness or that mechanical force are going to destroy the basal ganglia, decreasing the dopamine. Proof of that you have boxers that are going to have Parkinson in advanced age. Right? We got it? We okay with that?
Yes.
All right, so here we have the terminal axon. Here we have the dendrite. Here we have the synaptic gap, the gap. This is the presynaptic, because it's before synaptic. This is the postsynaptic. This is the portion of the dendrite, right? So, and that is how they are going to pass the electrical impulse and passing with the neurotransmitters. There is three options for the neurotransmitters. Some of them are going to pass directly, some of them are going to return, reuptake, and some of them are going to be destroyed in the pathway. Simple, right? So that is happening in every single nerve cell, in every single neurotransmitter. Oh, I forgot to mention this. What are the names of these crocodiles? Of course, you're not going to say crocodiles if somebody's asking, right? All right. So these enzymes who are going to destroy, enzymes who destroy the neurotransmitter in the gaps are, in the synaptic gap, are going to be the MAO and the COMT. Two hormones, two enzymes who destroy the neurotransmitters. Okay? The cholinesterase, that is the one, this is the crocodile who destroy the ACH. And the MAO and the COMT can destroy adrenaline, noradrenaline, GABA, glutamate, dopamine, many others. Okay, so, but these are the three names of the crocodiles. And there is actually, you just need to know what are the names. CO-methyltransferase is the COMT, and MAO is the monoamino oxidase. We don't care about that. Just remember MAO, COMT, and cholinesterase. Cholinesterase, very suggestive name. ACE, A-S-E, enzyme. Cholines means acetylcholine. Is the one who destroyed the acetylcholine. MAO, COMT, destroy adrenaline, noradrenaline, dopamine to serotonin to, and we use this knowledge in order to improve what we want to do. Increase the serotonin in depression or decrease the production of neurotransmitters during the schizophrenia. You okay with that?
Yes.
What time is it, please?
8:25.
Okay, so let's finish this. Let me see if I have. Yeah, we almost. Oh, yeah. I need to do few more things. Okay, all right. So for this, I want just you to remember the herpes zoster. Herpes zoster is actually shingles. Shingles, okay? Shingles, other shingles. It's a recurrence of the chickenpox. Chickenpox is a virus that can happen when the person is young, and actually this chickenpox can be dormant for many years. In adult life, they are going to show as a shingles. It's called the herpes zoster. Why I'm doing the herpes zoster here? Why? Because if you see shingles in the past, do you see shingles in the past? So where are located mostly?
Is it the back?
On the ribs, right? close to the ribs, right? On the back ribs, right? Excellent. So if you see the ribs, this is a rib, another rib, another rib, another rib, and on the top of the ribs are going to pass a nerve. This is a nerve, the intercostal nerve. The intercostal nerve. When this virus, they love the intercostal nerves. So that's why you see shingles like a line on the back, from the thorax to the back, because they following the line of the intercostal nerves. Okay? The sciatic nerve, if you see here, tell me, in the past, did you hit your elbow against the board, the table, and they do like a very painful electricity sensation? Do you feel that before?
Yeah.
That is exactly what happened, the same sensation with a sciatic nerve. Every time you walk. Very bad, right? Very, very bad. Sciatic nerve is the largest nerve on the body. It's the largest nerve. So please, it's not just one nerve. I told you, it's like a rope. Like a rope that has a lot of fibers, millions and millions of nerve cells are interconnected to each other to create a big structure that is the sciatic nerve. And that happened with the nerve or the radial nerve, the ulnar nerve, the median nerve, sciatic nerve, brachial nerve. We have many others. We have cervical nerves. We have, pudendal, whatever. So we are not going, we have hundreds and hundreds of nerves. But the one I want just to pick up, because that is what you're going to see in the future, near future, is the sciatic nerve. Another time, we have time, I can tell you how to know when is sciatic nerve, because there is two sciatics, the major and the minor. So sciatic in general. Multiple sclerosis is an autoimmune disease, autoimmune disorder. Doesn't matter. But autoimmune. You destroy your own body. What is going to destroy? The myelin. The myelin is going to be destroyed by your own body. The multiple sclerosis. So that produces pain, that produces a slowing of the patient. They cannot move. Gait, they have produced a lot of problems during the locomotion because of this multiple sclerosis. I'm not going to talk about that. No. Reflex, we already talked about that. And here we have one last thing before we go to the cranial nerves. All right, so this is a guy. Here we have, I will say, look at this. How many vertebrae we have? We have 7 cervical vertebrae, right? C1, C2, C3, C4, C5, C6, and C7. All right. So, but we have 7 cervical vertebrae. But we have 8 cervical nerves. How come? Why? Because we have one on the top of C1. That is called C1. On the lower portion of C1, C2. Then C2, C3, C4, C5, C6, C7, and C8. Okay? Now, you are going to stop breathing if you have an injury. If you have an injury, I don't want this. How you do this? Oh, God. Okay, there you are. If you have an injury here at C2, you are dead. All the connections of the heart, the lungs are going to be totally disconnected with the central nervous system if you have an injury at the level of C2. You okay with that? Now, this actually, I will tell you now. we have, when you're doing the nursing assessment or physical exam of the nervous system, when you have a problem of the nervous system, the number one sign or symptom that happen is numbness. Correct me, please. Numbness. No, numbness, right?
N-U-M-B.
N-U-M-B.
Yeah.
With double S or one S?
Double S. Yeah.
Double S. Numbness. Numbness is the same to say, medical terminology, paresthesia. That is number one happen. When you have a nerve injury, the number one thing is numbness, paresthesias. So you don't feel that area. Second, you're going, after that is getting worse, is going to be actually paralysis. Paralysis. Or motor deficit. That means that, for example, you are the patient. Okay, I'm the patient. You are the assessment. You're doing the assessment. With your right hand, you ask me to give you your hand and squeeze your hand. Okay? All right, so you check the strength of the hand. Now, you, with the same hand, you ask me to grab with my other hand, your hand, and squeeze. And that you're going to compare the strength of one side to another side. You can actually make the flex the leg when the patient is laying down, and make the patient push your hand, and with the same hand on the other side to compare if there's a difference of strength. So that is the motor deficit, or in the words, paralysis. Okay? Always use the same hand, because your left hand is weaker. If you're right-handed, the left hand is weaker, and the perception of the strength of the patient can be changed. Make sense or not? No? No makes sense?
Yes, it does.
Okay. Please don't let me alone, because, okay. And number 3 are going to be loss of the DTR. What is DTR?
Deep tendon
reflex. Beautiful. So the deep tendon reflex are happening at the end. Never is going to be deep tendon reflex without numbness. No, this is number 1, then number 2, then number 3. In that order, always. That is telling you that patient is having problems with some nerves. So you can tell if this is upper neuron or the lower neuron with that paralysis. If the paralysis flaccid, is from the spinal cord to the extremity. If this is spastic, that means that the lesion are going to be coming the connection to that area of your body that you cannot move, but the lesion is on the spinal cord. First motor nerve. And for that, you're going to do the Babinski. You okay with that? All right. So now these nerves this is the column, they're going to have spinal nerves coming out, And that is what is showing you here. These spinal nerves are going to give innervation to the skin, and all the sensation are going to be given by C3. So C3 is going to be basically on the top of on the lower portion of your head. So all this is C3. So you touch you here, C3. Touch to your shoulders, C4, C5, C6. So that's why we are mapping. We can map where the lesion is. Nice or no?
Yes.
Nice. All right. So these bands, for example, this band of C4, this band of C5, this band of T4, this band of T8, those are called the dermatomas. Of course, there's got it here. Dermatomas. Okay, we got it?
Yes.
All right, so now, all right, so how beautiful is the brain, right? You don't like the brain? Why are you quiet? Arby, you don't like the brain? You don't like it? Oh, thumbs up. Okay. All right. All right. So let's go to the previous class because we are going to need to do the cranial nerves. Are you ready? Any questions so far?
No.
Listen, if you follow all the information, I know that is a lot. But you know what? Basically, I'm shrinking a course of neuroanatomy into 4 hours. So I'm trying just to give it the what you need. If you know all this, you will be excellent. So please. All right. All right. So now let's go to the previous class because we need to do the cranial nerves. Yes, that is the strawberry on the cake. You like strawberries? Okay, let's do the strawberry. Catherine, you're thinking about things. You like it, right? You like neuro? You don't like it? Huh?
It's okay.
It's okay. What is okay? No, you see, excellent, perfect. No, it's okay. It's okay. That's fine. I'm not pushing. All right, so let's go to the cranial nerves. For that, we have 22 minutes, so more than enough. And now you can tell why I left this, because here in this class was not really, you cannot have the perception of what are the cranial nerves. So number one, the cranial nerves are part of the peripheral nervous system, correct? And the cranial nerves are going to be using the acetylcholine. So are cholinergic effect, all right? So the acetylcholine is the one who make them work, the cranial nerves, all right? We okay with that? All right. These cranial nerves are going to be very important. You know why it's important? I will give you the panoramic view. For example, we have the olfactory cranial nerve. The olfactory cranial nerve is actually, you can close your eyes and tell, can you smell this? What is smell? Oh, you need to be careful. So if the patient is actually say yes, 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 close your eyes, and you don't put anything under their nose. Can you smell this? Oh yeah, sure, I smell. That is lying. So you need to be careful on that, okay? All right. So you put a smell, the olfactory nerve is actually working. The optic nerve, so how you say the optic nerve? You're going to go to the Snell's table to check what is the acuity of the eye. No, you just do this. Look at this. Can you see my hand? Yes. Okay, optic nerve is working. That's it. So you don't need to do the optometrist acuity. No. Now, this is 2 examples, okay? But what you are doing, what is the importance about this? The importance about this is when you check all these 12 cranial nerves, these cranial nerves are coming from the brain stem, except two, but the majority of them are coming from the brain stem. Now, when you check all the lists that I'm going to show you how to do it, literally you are actually putting your eyes inside the body of the patient, looking directly to the brain stem. If all these cranial nerves are working okay, fine, that means that the brain stem is okay. You are looking the brain stem. All right? So that is part of the assessment of inertia. All right, so let's get started. The cranial nerve number 1 is the olfactory nerve. Cranial nerve number 2, the optic nerve. I want you to remember these numbers: 346, 346, 346, 346, 346, 346. Number 3, ocular motor nerve. Ocular motor nerve. After the second, that is optic, the third is the ocular motor. Ocular motor. 3, 4, trochlear, trochlear cranial nerve, trochlear, and 6 is the abducens. So these names are important. You know why? Because 3, 4, 6, they are going to ask you, 3, 4, 6 are the cranial nerves who make your eyes move. So for example, Shafia. So look at my finger and don't move your head, only your eyes, and follow my fingers, right? Do you see that, the doctors doing that? Up and down, right? Why?
Yeah.
Because they are actually checking the movement of your eyes. So they are checking the cranial nerve 3, 4, 6. You're moving that without any, well, nystagmus, whatever. I'm not going to go on that, but you move that normally. That means your cranial nerve 3, 4, 6, the oculomotor, the trochlear, and the abducens are perfect. There is no lesion on that area.
Got it.
Okay. Then we have the facial number. So we have 1, 2, 3, 4, and 6, but 5 in between. What is 5? 5 is the trigeminal. Trigeminal nerve is going to be on the face here, like this. One branch, another branch, ocular, frontal, and the other mandibular. So you don't need to know the name. There are 3 branches. That's why it's called trigeminal. What is this trigeminal? This trigeminal produces the sensitivity of the skin of the face and the mastication. Trigeminal, mastication, produce the chewing. Trigeminal. Now, number 7. Number 7 is the facial. This is the easy one. Facial, because that is, you asking the patient, do you see the patient, the doctor telling, can you smile? Can you frown your forehead? That is what is doing the facial nerve. So the facial expression. Okay? Number 8. Number 8 is going to be the vestibular cochlear. Oh my God, what name is that? Listen to this. You already passed ear, right? Remember in bioscience, you have the outer ear, middle ear, and the inner ear. And the inner ear is composed by what? By the vestibule, the cochlea, and the semicircular ducts, right? So this is the name is the vestibular cochlear nerve. Simple. It's the vestibule because the nerve is passing through the vestibule and passing through the cochlea. So that's why this nerve for hearing is called the vestibular cochlear nerve. Nice? Okay. Number 9 is the glossopharyngeal nerve. The glossopharyngeal nerve, number 9, produces the swallowing. You swallow. So the doctor is telling, can you swallow saliva? Yes, you swallow saliva. So that means your cranial nerve 9 is good. The cranial nerve is good. I'm going to do the vagus nerve. Please, the vagus nerve is the cranial nerve number 10. Vagus is, vagus means in Latin, wandering, walking all over. Walking all over. So I will tell you about the vagus nerve. Vagus is, I'm going to mention here. Okay. Here we have the vagus nerve that I call the biggest nerve. The biggest nerve. Why? Because when you go the first time to Las Vegas, you walk a lot. You're wandering everywhere. And why it's called the vagus nerve? The vagus nerve, because they're going to innervate. You know what is innervation already. I already mentioned at the very beginning of the class how many nerves are being attached to these organs. How many nerves are attached to the organs? Innervation. These vagus are going to innervate what? The respiratory tract, are going to innervate the cardiovascular and the gastrointestinal. So they go from here, from the respiratory down to the GI tract, to the lungs, to the heart. So it's everywhere, this vagus nerve. Okay? And we are going to see more detail in a few moments. The accessory nerve. Accessory nerve is the shrug your shoulders. You shrug your shoulders. Shrug your shoulders. Shrug your shoulders. You shrug your shoulders. That is basically the accessory nerve. How you check that? Put your hand here on the shoulder and ask the patient to do up and down, up and down, up and down, and monitor the strength. And with the same hand, go to the other shoulder and monitor the strength again. So they should be equal. That cranial nerve 11 coming from the brainstem is okay. The hypoglossal nerve. Hypoglossal nerve is going to be the movement of the tongue. Movement of the tongue. So, and the strength of the tongue. How you check the strength of the tongue? You pull the tongue of the patient? No, of course not. What you're going to do is to ask the patient to do it now with me. Put your tongue under in the cheek, posteriorly, right? Inside, and push. Ask the patient to push. And with your hand, start to feel the strength of the tongue. Then with the same hand, you ask the patient to do the same thing in the other side. And push. And should be the same strength. That is the hypoglossal nerve or cranial nerve number 12. Okay? Okay?
Yes.
This actually don't like somatic, general, special. That is actually not. I don't want you to know that. All right. So let's start. Number one. How many? Oh, number one. What is the nerve? What is the name of the nerve?
Olfactory.
Olfactory, right? Olfactory. How many noses you have? How many noses you have? One. Olfactory. One nose. How many eyes you have?
2.
What cranial nerve is that? Number 2. Okay with that? Now we have 3, 4, 6. 3, 4, 6 always like the Three Stooges. They're coming all together. Number 3 will be 3, 4, 6 is the eye movement. What is 3? The ocular motor nerve. What is 4? Trochlear. What is C? The abducens. So we have 1, 2, 3, 4, 6. Then we have the 5, the trigeminal. Trigeminal is going to give you the sensitivity of the face and produce the mastication. So we have ophthalmic, maxillary, and mandibular. So these 3 branches. You don't need to know those. Just remember trigeminal means 3 branches. Sensitivity and movement of the masticatory muscles. Who is this? So we have 1, 2, 3, 4, 5, and 6. Now let's go to number 7. I want you to check that 7. This is 7 upside down, correct? Yes or no?
Yes.
Another 7 upside down, yes or no? Another 7 there, and another 7. So what do you have here? You have a face.
Frankenstein.
All right? Excellent. You have a face here. That's there. A face. Right? So that is the facial nerve. Because with the 7, you can draw a face. Okay? Just to remember. Now, number 7. This is 7. You know the Roman numbers, right? Everybody knows the Roman numbers? That is a must.
Yes.
Okay, so please don't scare me. Okay. Now, what is number 8? Read. What is number 8? 8V. Vestibular Cochlear Nerve. Repeat that with me. Vestibular
Vestibular Cochlear.
Cochlear Nerve. And how is that? 8. Look at this. That is not the ear of the monster? Oh no. That is number 8. You okay with that?
Yes.
Number 9. This is the head, and this is the tongue. What number we have? Number 9. That is the glosso. Glosso means tongue. Glossopharyngeal. That is going to make the swallowing process. Number 11, 10 are going to leave at the end. Number 11 is like 1 here. So you have your shoulders up and down. It's like you said, I don't care. I don't care. I don't care. I don't care. That is actually the accessory nerve. The cranial nerve number 11. You okay with that?
Yes.
Number 12, this is the one you need just to memorize, is the hypoglossum. Hypoglossum. Hypoglossum, hypo, below, glossum, tongue is the muscles, are going to be the strength of the tongue. Tongue strength. Okay? And the last one is the number 10. Number 10 is called the vagus nerve. It's called the pneumogastric nerve. 2. Most commonly, vagus nerve, cranial nerve number 10. Okay, so this vagus nerve, how you check that? There is 2 ways. There is different ways. The cranial nerve number 10 are going to be this. You're going to open the mouth, and with the stick, you stimulate the posterior portion of the pharynx. And what happened is going to have a gag reflex, like this. Yes or no? Right? So that is telling you that you have your cranial nerve okay. All right. So now, when was the last time we were drunk? Harvey, you're smiling, right? You don't get drunk. You are too.
Last night.
There you are. What the last night? You was a guy. You were recovering. What you're talking about?
I'm just kidding.
You recover like that? You don't recover. Okay. All right. So when you are drunk, you want to vomit. Yes or no? Everybody say yes. See, everybody's smiling. Say everybody knows. Okay.
The next morning, for sure.
Yeah. So what you're going to do? You put 2 fingers on your throat and push, and that make you vomit. Yes or no? Right? So why is that? That is the vagus nerve. The vagus nerve is passing through the posterior wall of the pharynx, and they're traveling through the heart, traveling to the nerve, to the lungs, to all the GI tract, and that produces the vomit. When you squeeze, you push in your nerve, the posterior wall of the pharynx, that is going to stimulate the vagus nerve and produce the vomit. You want another example? I'm going to give you another example. Tell me, when was the last time you eat a lot, really a lot? When you eat a lot, you feel like dizzy, correct? And your stomach is totally distended, correct? Right? Do you want to vomit when you eat too much? Right. So mechanical pressure of the food against the walls of the stomach is going to be the same situation when you put your fingers your throat. Why? Because in the stomach, that is where it's passing to the cranial nerve number 10. So over this tension, produce a stimulation of the vagus nerve and produce the nausea and vomiting. Conclusion, recap about this. 12 cranial nerves. 1. Second, those are coming from the brain stem. Assessment is important. I'm going to ask you how to assess in this exam. The answer is no. What I want you is to know the names of the cranial nerves and what they are doing. That's it. That's it. Cranial nerves and what they are doing. Okay? So that is going to give you basically the base of what you're going to do, your neurological assessment. Thank you so much. That's all. Colorín colorado, este cuento se ha acabado. That means the end of the story. All right, so I hope you enjoyed this class as much as I enjoy it. I know this is a lot of information, but you exactly have, we can talk more about many other things, I can tell you. But this class of the nervous system, the previous and today, was really intense, but basically important. That is going to take you to the next level. Okay, so you are making a difference with other people right now. All right, so keep going like that. Thank you so much. I will see you on when? When I'm going to see you?
Dr. G, don't
Sunday.
forget about putting out the quizzes for us to view.
Oh, okay. All right, so let's do it now. So we have, let me see if you can see it now. So please check it out. Let me go to Moodle. Thank you, Mark. Okay, nursing vocational, anatomy, physiology, and then we have and every night you please help me with that because almost I forgot. Quiz 3 p.m. All right. Oh, no, quiz 4, right? Yeah, quiz 4.
Yeah, quiz 4.
I'm going to open the quiz number AM in the morning. Let me see settings. Span. They are going to open until, I told you until tomorrow, right? Let's do it one day, right? Until the 20th.
Yes, please. Thank you.
And until 11:59. All right, so you have I'm going to decrease the time. All right, 45 minutes. I'm not going to change them. And then here we have review options. Later, the attempt until it's open. Can you see that? I'm checking all the options to correct. After the quiz is closed, no. But here, later, while the quiz is still open. It's still open until tomorrow at 11:59. Okay?
Yes, thank you.
Just a moment, I didn't do yours yet. That is in the morning. Now let's go to the night, your group. Okay, span all. 20, 11:59, 45, and then here all the options. And please try to open it in a few moments just to check that everything is working fine. Okay, refresh, please. Just a moment. Now, refresh and try to open it.
It works.
It works? Yes, excellent. Okay, let's go. No, you need to study. I'm going to sleep. I've been teaching from 10 a.m. Okay, muchas gracias. Thank you so much. I hope that you, how do you, tell me feedback about Shafia. about the class, please. Everything that you think yourself. What do you think about the lecture today?
It was interesting, very detailed.
Okay. Arby? Miss Arby?
I appreciate your teaching, Dr. G.
You're learning today, or promise you're going to study a lot, right?
Yeah, I guess.
Okay. Sherry, what is your comment, please? Or whatever you want to say, you probably know.
A lot of information, like usual, and I need to study more.
Yeah.
But thank you, Dr. G.
Thank you, Miss Sherry. Miss Sophia?
I thought it was good, a lot of information, and I felt like I followed more today than normal.
Yeah, it's true. We have.
I always appreciate the videos you show.
Yeah, I'm trying to show some videos, not all, only just what is the portion that is needed. But thank you so much. Chelsea, please. What do you think?
I thought it was good. I like the techniques you use to help us memorize everything.
Okay, so use that, and I'm sure. Don't tell. How do you know that? Don't tell. Just nervous system. Okay. Please, Catherine.
Yes, I like the examples and like the pictures that you showed us to help us memorize the lesson today.
In some moment, I saw you that probably was overwhelming, right? But definitely, I think everybody has the. Remember, I was telling you about how I know how to deliver newspapers. Yeah, hard times, but this is going to pay off. I'm sure, Catherine. Keep going what you're doing. Thank you. Lisbeth? Okay, Lisbeth. Okay, go directly to the jugular.
That was a lot of information. I'll be honest, I was a bit distracted during the class, but I guess this weekend I have a lot of studying to do. I don't know. I guess I was a bit upset about the quiz and
what quiz?
Just
the
kind of
anatomy?
Yeah, so it's kind of threw off my whole mood all day. So.
Well, we are in the middle, so just remember the midterm is very important. The midterm is going to be next Wednesday, yeah? This coming Wednesday is
next
the midterm.
Wednesday.
Yeah.
Okay.
It's the 24, right? No, 26. 26 is the midterm. So for that, I'm going to duplicate my tutoring. So we are going to do twice in that week and double time. Okay? Mark, any comment, please?
Today was really heavy on the information, but I thought you did a very good job delivering, as you said, like you're condensing a whole subject in 4 hours. I like the way how you teach the class and how you provide examples and different mnemonics to help information to retain. It's just, we do have to do a lot of studying, but I appreciate what you do.
Thank you, Mr. Mark. Thank you. Mr. James, any comment, please?
Yes, I liked your ocean video and how you compared it to the electrical impulses.
Yeah.
Thank you.
Thank you so much, James. Thank you. Steffi, a wrap up.
I enjoyed hearing your life story, and it's like a pep talk to just keep us motivated and just let us know that everything's possible.
Exactly. Thank you so much. And everybody can do it. Everybody can do it. Sometimes I was give up, but definitely I was keep going. Thinking about, you know what? One step at a time. When you have difficult times, do it one step at a time. And each step, do it right. That is going to make your way. And you're going to come out from the problems. Because problem doesn't last long. It's affecting us emotionally, physically, but yeah, we are humans. We have actually weaknesses, but we have strengths to use it. Okay, next time I can show you how to throw a newspaper. I'm very proud. I learned how to do it. All right, muchas gracias. Thank you so much. I will see you next class. I will see you next. By the way, we have Sunday. I'm going to do Sunday. I'm going to do Tuesday, and I'm going to do Thursday. So another Thursday until what time you have class tomorrow?
10. Till 10.
Till 10.
10.
So I will do Thursday. I will adjust because I have tutoring of pharmacology. And yeah, and that is going to be a little bit tough time for me, but I'm going to do an extra hour for you on Thursday before. No, Thursday is already past the midterm. So we need to do before that. Sunday, Monday too, right? Monday we have class. So we can do tutoring Monday at 10:30. After class. No, 9:30. What about 9:15? We have a break. Yeah, I know it's going to be a long day for me too, but definitely it will be worth it because that can increase your grades. Okay? All right, so we are going to do Sunday, Monday, and Tuesday. 3 days in a row. Okay, we start this Sunday, Monday, and Tuesday, 3 days. And you will remind me, please. Please, please. Okay?
Okay.
All right, guys.
Thank you.
So
Good night.
much. Good night.
Thank you.
Okay. Thank you,
Dr. G.
Thank you. I'm going to stop recording because I guess somebody wants to say something.